Hello po muli, pagpapatuloy ng ang ating pag-aaral, palpation sa chest and breast na po tayo. Chest. The center of the chest corresponds to the heart and the rest of it to the lungs. So yung chest po natin ay una heart and lungs. So palpation of the chest reveals the state of the heart, lungs, and pericardium. And generally speaking, pag may tenderness po sa ating pagpapalpate, nagsasabi po ito ng full condition, isa po sa mga organs na to. For example, kung ang chest po ay feels very tender, kahit po light lang yung pagpatong ng inyong kamay sa center area, dito sa Ren-17, CD17, it may indicate heart blood stasis. Yan, pag matigas po heart blood stasis po yun. Hawakan na po niyo yung mga dibdib nyo. So if the chest is tender on palpation in the areas around the center, it usually indicates an excess condition of the lungs and open retention of phlegm sa lungs. So yun ang pag sa naman po, around the center. So lungs naman po yung ating tinitingnang organ. Pwede daw pong may retention ng phlegm. By contrast, if palpation of the chest relieve discomfort, yun. Pag pinalpate mo, diniinan mo, nawawala yung mga sakit nararamdaman, nagsasabi po ito ng deficiency. Condition of the heart or lungs. Kung superficial palpation po sa chest at nare-relieve ang pain, but the patient feel discomfort with deeper pressure, so nagsasabi po ito ng combination, deficiency and excess. Pag pinatong mo ganun, pinalpate mo at nare-relieve pag dinainan na sumasakit, so deficiency and excess. Sa chest, so tender with light palpation of Ren-17, summary po ito, ibig sabihin ay may heart blood stasis. Then kung may tender around the center, excess condition ng lungs. Tender relieved by palpation, deficiency condition of the heart or lungs. Tender relieved by light palpation but elicited by deeper palpation, combination po yan. Yung kanina ko sinabi, deficiency and excess. Okay, next is breast. So bago po tayo magpapalpate, magpaalam po ha. Lalo pa kung ang mga acupuncturista ay lalaki, syempre minsan mas magandang nagpalpate yung babae kasi i-consider po natin yon. So palpation of the breast in the woman is carried out when there are breast lumps. Yan. Minsan yung pasyente yung pinapakapa. So pag may breast lump po, pero pag tayo mga babae, okay lang nagpaalam tayo Maybe malignant or benign. So the purpose po ng palpation sa Chinese medicine is never to replace the Western diagnosis. So we should never rely on palpation to distinguish benign from malignant lumps. So kailangan po nating patingnan po yan sa doktor. But to identify the patterns causing them, so the palpation of lumps should take into consideration their tenderness, their ages, and their mobility. So relatively soft phlegm po ito, yung mga nakakapa nating mga bukol-bukol sa area ng ng breast. Pag hard po, pwedeng may blood stasis. Pag distinct ages, pwede pong may phlegm. Distinct ages, pwedeng toxic heat. So mobile on palpation, kumagalaw po yung mga masses na yan, pwedeng phlegm. Pag immovable on palpation, blood stasis po ito or toxic heat. So kung small at movable po yung lumps na nakapa, with distinct ages and which change size according to the menstrual cycle, normally indicates fibrocystic disease of the breast, which is usually due to combination of phlegm and chest stagnation po yan. A single, relatively hard, movable lump with distinct ages, which also may be slightly painful, usually indicates a fibroadenoma, which from the Chinese point of view, combination po ito ng phlegm at saka blood stasis. A single hard immovable lump with distinct margin without pain, pwede rin po itong indicate carcinoma of the breast. So, basta't may nakakapa ng gano'n, refer to doctor. Sa Chinese medicine po, usually due to combination of phlegm, chest stagnation, and blood stasis, occurring against the background of disharmony of penetrating and directing vessels. Dahil minsan pag inacupuncture natin, yung mga ano pong yan, bukol-bukol, mga lumps, nawawala po siya. Pero syempre, mas maganda na rin katulong po yung mga doktor. I-refer po rin natin sa doktor. So, most common breast lumps, ito po yung fibrocystic disease. So pag sa atin po, sa TCM, chest stagnation and phlegm po ito. Small, multiple, movable po yung klase lumps. With distinct ages, changing size occurring to the menstrual cycle. Yung pag magme-mens sila, biglang lumalaki. Pag tapos na nilang mag-mens, lumiliit. Yan. Itong fibroadenoma naman po, blood stasis po yan. So single siya, relatively hard, movable lang with distinct ages, possible, painful. Yan. Carcinoma of the breast, ito ay blood stasis and phlegm. Single, hard, immovable, painless lump with indistinct margins. Yan po yung mga nakakapa natin, breast lumps. So breast lumps, there are 4 broad categories of breast lumps in Western medicine. Pwede po siyang cysts or fibroadenomas, breast nodularity, and carcinoma of the breast. Ay, parang mga cancer po siya, no? So, cysts, also called fibrocystic disease, are the most common benign condition of the breast. Pag benign, nawawala din lang yan, ano? They are usually bilateral and feel soft and movable on palpation. So, kung acupuncture, nawawala po siya yung iba. So, from Chinese point of view, they are usually due to phlegm. Cysts are most common between the age of 30 and 50. Yan. Yung mga phlegm, po yung ano. Pag fibroadenoma naman po, the next most common benign breast disease. So, benign naman siya. Occur most often in young women. The adenoma is usually a single unilateral lump and on palpation feels harder than a cyst. So, from the Chinese point of view, dahil po ito sa blood stasis or a combination of blood stasis and phlegm. So, fibroadenomas are most commonly between sa age po na 20 and 30 years old. Breast nodularity and tenderness occur before menstruation. Bago magme-mens, ano? So, usually decrease after the period. Pag sa Chinese point of view po ito, breast nodularity is due to combination of liver chi stagnation and phlegm. Kasi di ba pag may liver chi stagnation, siya yung nagkukuman sa smooth free flow of chi, hindi nagpo-flow ng maayos, kaya mayroong mga nodule tayong nakakapa. So it is common between the age of 30 and 50. Pag carcinoma naman, sa breast usually present with a single painless, unilateral, immovable, hard lump with distinct margin. So its incidence is highest after the age of 50, yung mga 50 years old na pa, no? So it is nearly always due to a combination of phlegm and blood stasis. So occurring against the background of disharmony of penetrating and directing vessel. In carcinoma of the breast, there may be toxic heat in condition to phlegm and blood stasis. So phlegm is usually manifested by a swollen tongue with sticky coating. Blood stasis by a purple color on the breast areas of the tongue. Natandaan po natin yung tinuro ni Sardino saan yung part ng breast. So, and toxic heat by red tongue with thick, dry, dark yellow coating and red point. So, pag nakakakita po tayo ng mga carcinoma, check po nyo yung tongue. Marami po kayong makikitang red. Yan. Red, dark, yellow. Ayan. Ayan po yung corresponding tongue area. And pag doon nyo nakita, ipalpate po ninyo yung sa chest ay sa kanilang breast area. Yan. Magkakapareho po yan. So, tandaan na po natin sa tongue. So, 3 factors na nagkakaroon ng breast lumps. Una, kung meron pong chi stagnation. So, paano nagkakaroon ng chi stagnation? Pag hindi maayos na nagpo-flow yung chi ng ating katawan, magkakaroon din po yan ng blood stasis or pag maraming phlegm. So that's the three most common patterns leading to the formation of breast lumps, benign or malignant, are cheese stagnation, blood stasis, and phlegm. However, the first of these three of these cheese stagnation usually accompanies the second and third. Sa Chinese medicine po, ang cheese stagnation ay nagli-leads ng formation of breast lump. Siyempre kasi nga, kung hindi nakaka-flow ng maayos yung ating cheese sa katawan, magkakaroon ng pagbabara yun. Nagkakaroon ng mga bukol-bukol. So it usually considered to be the result of emotional stress. Yan. Hindi nagagampanan ng liver yung pag-uutos niya, mag-flow kayo ng maayos dugo. Kasi lagi kang naiinis, nagagalit. So this may be the liver cheese stagnation caused by such emotion as anger, resentments, or frustration. Yan, yung mga, akala nyo yung mga laging nagagalit, yung mga laging frustrated pakiramdam sa buhay, pwede po kayong magkaroon ng breast cancer. Or lung cheese stagnation, na lagi kang nalulungkot, lagi kang nag-worry, yan, or grief. Both condition affect the breast and may lead to the formation of lumps. O, bigla kang nagtaka, ba't may mga bukol-bukol ka na? Kasi check mo yung emotion mo. Baka yan ang nangyayari sa iyo. So remember, cheese stagnation affecting the breast may derive not only from the liver but also from the lungs. Siyempre yung connection ng liver, di ba? Yung sa co-cycle. Ipapasa ni liver kay lungs ang kanyang weakness. So ito po, may case history tayo. Tingnan po natin. May 39-year-old woman had been suffering from a lump in the left breast, upper left quadrant. So alam na po natin yun, ano? 5 years na po niya itong nararamdaman. Ang size ng lump had vary in the relation of her menstrual cycle. So increasing slightly before the period and decreases afterwards. Pagkatapos niyang mens, lumiliit yung lumps. The lumps was sometimes also painful. A biopsy, mammogram, and magnetic resonance imaging, yung MRI, scan had confirmed the absence of any malignancy. So hindi siya malignant. So the lump was neither fibroadenoma, assist and had been described simply as breast tenderness and nodularity. So sa palpation, ang lump was firm but not too hard, elongated to at mobile. So there was no lymph node involvement in the axilla. Yung her period was regular, not painful, and neither too heavy or scanty. She did suffer from premenstrual distension of the breast and abdomen. She had no other symptom apart from tendency to lose stool. Naapektuhan yung spleen. So on observation, yung complexion niya ay dull, sallow, and her eyes were slightly staring. So there was also a horizontal red veins starting from the outer corner of the left eye. So red, alam natin, heat, and reaching the edge of the pupil. And in addition, the white under the pupil was visible. So this is not normally visible. Dapat ang normal, hindi siya nakikita. Ayun. Yan, may puti. Then may guhit. Horizontal vein in the eye. Yan. So, ayun po. Tingnan natin. Okay. Left eye. Yung tampo niya ay red on the side and tip. So, tip, yung heart, had a yellow coating. So, yellow coating is heat. And teeth marks in the left breast area. So, dampness or Her pulse was slippery on the whole. The left side was slippery and wiry on the liver position, while the left front position was relatively overflowing. The pulse was also slightly rapid. So, excess condition, overflowing, heat, rapid. Teeth marks in the left breast area. And sign of damp or damp heat, dampness. Yun, may crack in the center line. So, ang diagnosis po ay, in breast lump, the most common pathogenic factor are may liver cheese stagnation, liver blood stasis, and phlegm. A pairing and a varying combination in this case, there are signs of all three patterns. There are liver cheese stagnation because of premenstrual distension. Yun po yung patunay na may liver cheese stagnation siya. The varying size of the lump in relation to menstrual cycle and the wiry pulse. There is liver blood stasis because the lump is firmly and slightly painful. Yun yung nagpapatunay na liver stasis. Kasi nga po, firm and painful yung kanyang lumps. Tapos yung kanyang pulse ay wiry. There is phlegm because pulse is slippery. Phlegm ano, tandaan natin, pag may slippery, either phlegm or dampness. So liver cheese stagnation and liver blood stasis are the prevalent pattern compared to phlegm. So yung chronic liver cheese stagnation has given rise to liver heat and heart heat. Yung evidence po dyan ay yung red side sa tip ng tongue at na-confirm din to sa rapidity of the pulse and overflowing quality of the heart pulse. Yan. Then the teeth marks at the left breast area of the tongue indicates the breast pathology occurs against background spleen-chi deficiency, and which also confirmed by the tendency to lose stool. Oo, kasi di ba yung nagdudumi siya. The slightly staring look at the eyes indicates that the mind and spirit are disturbed from the emotional problem, which an interrogation. So she confirmed having the showing of the white under the pupil is generally a poor prognostic sign. The red vein in the left eye was in the heart and lung area in the lower part of the sclera, corresponding to the chest. So, yun po yung ating case study. So, pwede po natin balikan yan, pag-aralan natin para alam natin paano yung diagnosis. Yung mga sign and symptom, nandun po nakapila. Paano mo sasabihin na may heart fire siya, nandun na paano. So, pwede po natin balikan para mas masanay tayong tumingin ng mga case presentation. Thank you po for your attention.